Welcome to this short video presentation on urinalysis for OSCEs. The objective of this session is to understand the reasons for performing a urinalysis, to be aware of the safety checks involved, to be aware of the universal precautions needed in personal protective equipment, to know the procedure of performing a urinalysis, and to understand why students fail this station. Fortunately, this station is usually fairly well done, but students do fail because they fail to perform the basic checks, the patient safety checks, checking they've got the right patient. Occasionally they misread the urinalysis strip. Sometimes their technique is poor and this causes an inaccuracy in the readings. I've seen students hold the strip upside down, which obviously gave them completely incorrect readings. Some students seem to be unable to time out the necessary 2 minutes to perform all the tests. The equipment for this station is very basic. Along with the urine sample, you'll need urinalysis strips, non-sterile gloves, an apron, some tissue, and a watch or a clock to time the events. First of all, don personal protective equipment. So wash your hands, put on an apron, and put on gloves. I can't imagine they will provide goggles at this sort of station, but if they do, then certainly put them on. So perform your basic checks. Check that you've got the correct sample from the patient that you want to test. So check the patient name, the hospital number, and the date of birth. Check that the sample has been recently passed, and also check the expiry dates on the reagent strips. Also worth noting at this point any medication that the patient might be taking, as this could affect the results. Start with observation. Look at the colour of the urine. Urine is normally straw coloured. An excessively dark sample could indicate dehydration, possibly myoglobin. Look for cloudiness and debris. That may indicate infection in the urine. Remove the lid from it and have a sniff. Fresh urine doesn't really have any smell to it, but old urine will smell of ammonia. Fishy urine indicates possible infection there, and the smell of pear drops would indicate the patient's possibly ketotic. So, remove the strip, dip it into the urine, fully submerging all the reagent areas on it. Once you've done that, immediately remove it and wipe off the excess urine on the lip of the container. Lay it down on a flat, dry surface to prevent the colours mixing, and start your timing from that point. Observe the reagent areas on the strip and then compare the colour of each reagent against the chart after the indicated lapsed time. This will vary from 30 seconds to 2 minutes. Very importantly, make sure you line the strip up with the chart on the side of the bottle correctly. Check all the reagent areas at the correct time and record the results. When 2 minutes has passed, you should have all the readings. Dispose of the strip, the gloves and your apron and the piece of tissue. Normally obviously you would bin the urine at this point, but however don't for the station because the examiner will need it for the next student. Further investigations will depend on your findings from the sample. If an abnormality is found on the urinalysis, then the examiner may expect you to say what you do next. So to summarise, check that you've got the correct sample for the correct patient, put on your personal protective equipment, have a look and a smell at the urine, remove the top, dip the reagent strip in, pull it out, and at the appropriate time, take the readings from it. Note the readings down and report your findings back to your examiner. Thank you for listening to us. We hope you enjoyed this presentation.